What is it again? Honey, what is it again?
I am tired.
Look, things will get better. Things will get better.
When? When is all of this going to get better?
But you know I'm doing my best. I'm doing the best I
did
can.
not say you are not doing your best. I am just tired, okay? I'm tired of all of this. I really am.
Look.
Take family planning. Oga, are you going?
The Nigerian Urban Reproductive Health Initiative, NURHI, was launched in 2009 as a 5-year project. Its major objective, increasing contraceptive prevalence rate CPR by 20 percentage points among the urban poor in 6 selected cities. In the last 5 years, more families in Nigeria know the correct facts about family planning. More couples talk about reproductive issues, and more women go for family planning products and services.
We started using family planning immediately after our first issue. When we had our first daughter, we now decided that in order for us not to have another child immediately, we have to go and see the doctor for advice because we don't know anything about family planning then.
I used to use to take injection. That's 2 months injection or steroid. So I started with it. It works well for me in general because I'm healthy, my body is okay, my bones, everything. To me, I will tell my fellow women to go and seek for it and they will enjoy their selves.
Let me say that family planning is not new to Nigeria. From time immemorial, we have spaced birth by using prolonged lactation and abstinence, as we are well aware. Even in the traditional communities, you have traditional methods, But what we have now are modern methods of conception. Many of them have been tested, they've gone through rigorous research, and they have proven efficacy as well as safety. They are not to be regarded as imported technologies. These are technologies that are quite safe for anybody to use.
To achieve success with its family planning campaign, NURHI adopted a consumer-first approach.
For the past 5 years, NURHI used a very strategic approach, which many have not really focused on in the past. And this is actually using the consumer lens. With other kind of products that people market, consumer is king, as we always say. So we use consumer lens approach to intervene in the cities where we worked. Because we use the consumer lens, we were able to have champions along the line, from the community level to the policy makers and even to civil society members that we embraced with.
I've been using family planning a year and 9 months now. Really, I don't have any problem. Actually, it was even my husband right from our courting relationship. It was immediately after our marriage, he started asking women, how is the family plan? It was even the one. I've never asked anyone before. The advice I have for the women according to the family planning is for them not to be afraid of it because it's very helpful.
The NURHI campaign message was carried far and wide on branded communication material.
The network for distribution was extremely robust. Apart from working with the social mobilizers, they were distributed also through the health facilities. You will find them at social events, you will find them at religious places, you will even find them in corporate environments because everybody needs access to information and services. And the choice of the materials were such that they were materials that were actually needed. And remember that the audience are people living in the urban slums. So we had beautiful umbrellas that market women would display their wares under. And the materials actually talk about family planning, know about family planning, talk about it and go for services. You have market bags that everyone loves to carry because the design is beautiful, the messages are simple, they are clear. You have stickers that you find on every personal car, on private cars, on keke napeps, even on motorbikes. And it's simple, it's the puzzle piece and it's get it together. You also find the logo and the materials on t-shirts that are brands for the social mobilizers, identification materials that also speak the legacy of NURHI project.
Most of the myths and misconceptions has been disabused, by the intervention of the NURHI. Because in the past, people say they will not come, that to fear, that there is a way of stopping them from having children. All this has been disabused by the presence of NURHI in this high environment. And it has helped a lot to increase the uptake of family planning services. Yes.
I work with the NURHI and I am also a tailor. When people come to sew their clothes, I ask them if they are aware of the program. A lot of people want to do family planning and don't have an idea of where to do it. And some even say they are shy to go to the hospital. I usually give them the Go card for free and even follow them on some occasions to the hospital and stay with them through the process. Some just come to collect the Go card and go on their own.
Social mobilizers are artisans drawn from the community, barbers, hairdressers, market men and women who received basic training on family planning, where to access information, and constitute a referral force in directing people, community members who actually need family planning, to centers where they can get information and services. The Get It Together campaign used a multimedia approach, which was a combination of television and radio and activities at the community level using interpersonal communication. I love NURHI campaign materials. They are unique, they are appealing, they are universally accepted, and I think the content actually is the crux of the success, because the content has been designed such that it's looking at family planning from the eyes of the consumer. So the language is simple.
Don't make woman what finish. We go do family planning. First thing tomorrow morning before I will cry.
The results of research on the NURHI project drove us to utilize television, and we decided to develop a TV drama series. And Newman Street is an organic platform that can grow and can provide the audience with that wide appeal. It's highly entertaining, and at the same time, it's really educative.
This one way they rejoice. You win lotto.
This one pass lotto.
Hey, that man is breeding criminals.
Of course.
The success of this campaign can be evaluated by comparing midline and endline data. At midline, the percentage of people who had heard the term "get it together" was 10.8% in Abuja, Ibadan 19%, 32.2% Kaduna, and 17.7% Ilorin. At endline, these figures had increased to Abuja 50.6%, Ibadan 79.4%, Kaduna 95.3%, Ilorin 62.9%. In order to reach the unreached and underserved, NURHI ensured that essential primary health care services such as maternal and newborn child health, HIV/AIDS, as well as immunization were integrated into family planning.
One unique strategy that NURHI used was integrating demand generation interventions with supply, which is services.
With respect to reduction of maternal mortality in the state, especially in how that is linked with family planning, what we're doing is that we are incorporating family planning services into our general maternity services. So when people come to the maternity centers, they are also counseled on family planning services that are available to them at those centers. And in fact, we are also in the process of incorporating family planning services into other services like HIV/AIDS services.
With the coming of NURHI, we were able to integrate family planning in various aspects of our reproductive health interventions. You see, at ANC, of course, we have, apart from the fact that we have a family planning clinic, but we are seizing every opportunity to introduce family planning services at every service delivery, especially maternal and child health service aspect. For instance, at PMTCT, when we are offering PMTCT services at our facilities, family planning was integrated into that. ANC, family planning was integrated into that. And even at child welfare clinic, where mothers bring their children for immunization, we try to integrate family planning into it. So it is all over, and we talked about it freely now. And more importantly, is to know where you can get the service.
Also, to improve family planning services, NURHI undertook renovations and equipment supply to health facilities situated in its focal cities. This was the 72-hour clinic makeover.
The 72-hour clinic makeover initiative was a fantastic one. I commissioned that project at Adeoyo Maternity Hospital. It's a NURHI initiative, and we believe that that concept of using minimal amounts to renovate a facility, we believe that we should replicate that, and we've started that already.
To build capacity and enhance service delivery, family planning providers in project cities received periodic training from NURHI.
And over time, we've trained a lot of people in this regard. I believe we trained about 1,250 healthcare workers, of which about 49% are nurse midwives, about 2% are doctors, 8% pharmacists and pharmacy assistants, 19% are CHUs, and about 22% are patent medicine vendors.
Complications are, we can describe them as untoward effects, severe consequences of a procedure or a medication that requires urgent attention.
We're leaving behind a well-documented toolkit, and this toolkit is the how-to, step-by-step of the how-to with the evidence. Even when we use the evidence to change modalities, it documented it. So we're leaving a resource behind, which we would desire for those interested to use to replicate.
One can say without any reservation that the NURHI project has been extremely successful beyond expectation.
If you look at all the states that NURHI is working, Kaduna for instance, all the sites that are working, we've seen a very sharp increase in CPR. We've seen a very sharp increase in public awareness.
So we hope that moving forward with NURHI will give us the results we want, because they've already proved. The states that NURHI has already worked previously before we joined to partner with them have shown it. In the DHS, the results were just out of this world. They were far higher than any other states in this country. So that's something we should emulate, congratulate them, and then adopt and replicate what they've been doing. So this is what we are trying to do.
I would say we had a very pleasant surprise. Like most people would say, the lines actually fell upon us in pleasant places. When NURHI baseline was done, we had different range of modern method of CPR across the cities. And of course, there are cities that were at the lower ebb. There were some that were at the midline, top line. Then at the end line, we had very interesting results, I would say. But the most interesting result that we didn't even avert our mind to was the DHS.
The National Demographic Health Survey 2013, when compared with 2008, saw modest changes in percentage point difference in CPR across most states in Nigeria. But significant increases were recorded in 3 NURHI operational states. In Kaduna, the percentage point difference was 10.1, Oyo 6.3, and Kwara 11.2. NURHI's Endline Data 2014 showed increases in contraceptive prevalence rate across all NURHI intervention cities when compared with baseline CPR. Abuja increased to 40.4% from 32.2. Ilorin increased to 34.5 from 26.9. Ibadan increased to 45.9 from 33.5, while Kaduna increased to 30.6 from 19.9.
The future of family planning in this country is very bright. And if we are all committed to this, the way NURHI is committed to the way they do their work, I have a feeling we have a very bright future for family planning in this country.